This is Speak Your Piece, sharing the opinions of your coastal neighbors on today's pressing regional issues.
Times like these require immediate action. We all need to do our part to stay isolated and slow the spread of COVID-19 and to strengthen the social safety net. Low-wage workers here in Wilmington and across our state experience the economic ramifications of the pandemic most immediately and deeply. Employees in the food service, tourism, and entertainment industries are facing a particularly uncertain future. The North Carolina Medicaid program, which is a joint initiative publicly funded by the federal government and the state, provides health insurance to 33,000 people in New Hanover County and more than 2 million people statewide. As a part of its COVID-19 relief effort, the federal government plans to pick up a greater share of each state's Medicaid costs. Appropriately, the measure does not allow states to make it harder for individuals to enroll in Medicaid, nor require cost sharing for COVID-19 testing and treatment. At a time like this, our first principle should be to make it easier for folks to find care, not harder. Here in North Carolina, the state has requested waivers from the federal government on many restrictions to better respond to the epidemic. The requests include waivers to restrictions on how long someone may stay at a hospital and other screening and enrollment requirements. It's excellent that this program can have this versatility in a time of crisis. It also calls into question the many restrictions and limitations on access that have been proposed for the Medicaid program in the past in North Carolina and other southern states in recent years. Just last year, a proposal was introduced, though it did not pass in the North Carolina General Assembly, that would have required all able-bodied North Carolinians who receive Medicaid to meet work reporting requirements. Sounds pretty backward right now, doesn't it? Moments when someone's job stability and income are in flux is exactly the kind of time that you need the guarantee of health insurance, whether we are in a public health crisis or not. Tens of thousands of people have lost their jobs in recent weeks, and additional bureaucracy puts those lives at risk. In Tennessee, our neighbors have proposed block granting Medicaid, which means that rather than the federal government guaranteeing to cover a percentage of a state's cost for the program, they would now provide a fixed dollar amount. Those who support block granting claim it will lead to increased innovation and flexibility, but in reality, it's just another form of a cut. This arrangement will incentivize the state to decrease its overall enrollment or benefits provided. Again, this practice is worrisome at any time, but this crisis brings to new light how draconian block granting Medicaid is. There are a number of other policy tools we need to combat COVID-19, but at its core, guaranteeing access to health insurance for low-income residents with as little restrictions as possible is going to be fundamental to our response. Let's remember these lessons when our policymakers aren't in a crisis. Medicaid is a critical tool to combat the opioid epidemic, which has hit North Carolina and Wilmington very hard. It's a linkage to treatment and mental health services. It also helps us stop the spread of HIV and hepatitis. Medicaid helps pay for pre-exposure prophylaxis, or PrEP, for folks who want to prevent HIV, and treatment for people who are living with hepatitis. Our policymakers across the country should be working to improve the Medicaid program and increase access, not hamper and obstruct it. We should be using every tool in our toolbox to get as many people into health insurance as possible. We need a strong Medicaid program to combat COVID-19 now, and we need a strong Medicaid program once we have flattened the curve and this crisis is over. This op-ed letter has been composed by Lee Storrow, the Executive Director of the North Carolina AIDS Action Network, and in collaboration with Jeff Mills, myself, a volunteer and Medicaid Ambassador with North Carolina AIDS Action Network.
You've been listening to Speak Your Piece. Interested in being on Speak Your Piece? Visit shoresides.org for more information on how to work with us. Thanks for listening.